Pregnancy Week 24. At 24 weeks, you are now over halfway through and well into your second trimester. This special time is filled with significant milestones as your baby grows and your body adapts to support its development. Your baby's facial features are becoming more defined, and they have reached a stage known as viability, which means they can survive outside the womb with appropriate medical care. As you approach your third trimester, it is normal to have many questions about the changes occurring between you and your baby. Stay healthy and comfortable as you prepare to welcome your little one during this important time. Week 24 Pregnancy Ultrasound. The 24-week ultrasound is an important routine examination that assesses the health and development of the fetus. This ultrasound is performed between 24 and 40 weeks of pregnancy. During this time, the technician evaluates the baby's size, structural anatomy, amount of amniotic fluid, and placental position. You may also see glimpses of your baby's features, as they resemble a smaller newborn and display movements like kicking or thumb sucking. The technician will check vital organs, including the heart, brain, kidneys, stomach, bladder, spine, and bones, and measure the baby's growth. If you want to determine gender, this ultrasound often provides a clear view. You can expect measurements of the baby's head circumference, abdominal circumference, and femur length to ensure that growth is on track. Your doctor will likely schedule a glucose challenge screening test to check for gestational diabetes. This test involves drinking a sweet liquid and having your blood tested after 1 hour. If the results are concerning, a follow-up test may be necessary to monitor your sugar levels over 3 hours. If you are diagnosed with gestational diabetes, don't worry, your doctor will help you manage it and may schedule additional ultrasounds to monitor your baby's health. Week 24 Size of the baby. At 24 weeks pregnant, your baby is about the size of a cantaloupe. The baby measures about 12 inches in length and weighs around 1.3 pounds. Much of this weight comes from the development of organs, bones, muscles, and the accumulation of baby fat. Week 24 Baby's development. At 24 weeks of pregnancy, your baby is growing rapidly. Their skin changes from a transparent appearance to a more opaque, rosy glow due to the formation of tiny capillaries. Your baby has white eyelashes, eyebrows, and hair because of a lack of pigment, and her facial features are almost fully developed. Unique footprints and fingerprints are forming, reflecting the baby's DNA. The baby's auditory system is developing, allowing her to recognize sounds, including your voice, which can provide comfort after birth. The lungs are forming substantial structures to create more surface area for oxygen exchange, and fetal movements are becoming more noticeable, indicating increased muscle control. Although the baby is still dependent on the womb, premature births can be viable with neonatal support, as the lungs need a substance called surfactant that is typically produced around 26 weeks to function effectively. It's important to stay aware of your baby's movements. Consulting your healthcare provider can help you monitor any changes. Week 24 Pregnancy Belly. At 24 weeks pregnant, you will notice a significant growth in your belly as your baby and uterus expand. Your belly will appear prominent and round, although its size and shape can vary depending on your pre-pregnancy body, your baby's position, and whether this is your first pregnancy. Many expectant mothers observe that their belly button has popped out due to the growing uterus, which is now roughly the size of a soccer ball. During this stage, your healthcare provider will measure the fundal height, the distance from the pubic bone to the top of the uterus, which usually measures around 24 centimeters, approximately corresponding to your week of pregnancy. As your belly grows, you may experience discomfort due to skin stretching, leading to itchiness or stretch marks. You might notice a dark vertical line called the linea nigra running down the center of your belly. This is a result of hormonal changes and typically fades after pregnancy. You may also start feeling occasional tightening in your stomach, known as Braxton Hicks contractions, which is your uterus's way of preparing for labor. Week 24 Pregnancy Body Changes. At 24 weeks pregnant, your body undergoes various changes, and you may experience discomforts like carpal tunnel syndrome due to swelling and fluid accumulation. This fluid redistribution can lead to numbness and tingling in the hands and wrists. Avoid sleeping on your hands to alleviate symptoms. Use supportive pillows, and take regular breaks from repetitive tasks. Consider using a wrist brace if pain persists, as symptoms usually resolve after delivery. You might also notice skin color changes, possibly indicating a rare complication called cholestasis of pregnancy, so inform your doctor. Hormonal changes can lead to unusual symptoms such as a metallic taste, skin tags, increased saliva, and vision changes. To ease discomfort, try cold water soaks or ice packs. At this stage, you may have gained around 10 to 15 pounds. A nutritious diet and regular exercise can enhance your physical and emotional well-being, benefiting both you and your growing baby as you near the end of the second trimester. Week 24 Pregnancy Symptoms. 1. Constipation. Many expectant mothers experience difficulty in bowel movements, leading to discomfort and bloating. 2. Lower abdominal ache. Women might notice a dull ache in the lower abdomen as the uterus grows, often caused by stretching ligaments. 3. Migraines. Some women may face increased headaches or migraines during this stage, often due to fluctuating hormone levels or stress. 4. Sugar in urine. Routine tests at the doctor's office may reveal the presence of sugar, which could indicate gestational diabetes or other issues. 5. Unusual thirst. An increased thirst may arise as the body works harder to accommodate the growing fetus and manage fluid balance. 6. Nausea. While this symptom often peaks in the early months, some women still experience waves of nausea at this stage. 7. Leg cramps. Sharp, sudden pains in the legs, especially at night, can disrupt sleep and are a common complaint among pregnant women. 8. Shortness of breath. As the uterus expands, it can press against the diaphragm, causing a feeling of breathlessness, especially during physical activity. 9. Mood swings. Emotional fluctuations can be heightened due to hormonal changes, leading to unpredictable moods throughout the day. 10. Swollen feet and ankles. Fluid retention can lead to noticeable swelling, particularly at the end of the day or after prolonged periods of standing. Week 24 Pregnancy Checklist. 1. After your baby arrives, start researching childcare options, considering location, cost, and compatibility with your family's values. 2. Start planning your baby's nursery by considering the color scheme, furniture layout, and essential items for a safe, nurturing space. 3. Schedule your glucose screening test to check for gestational diabetes and ensure a healthy pregnancy for both you and your baby. 4. Start your baby's library with cherished picture books. Early reading fosters a love for books and supports language development. 5. Baby-proof accessible areas and have the necessary supplies ready to create a safe, welcoming space at home for your new arrival. 6. Learn to quickly recognize the warning signs of preterm labor to respond to any concerns. 7. Start practicing pelvic floor exercises, which can help strengthen the muscles you'll rely on during labor and postpartum recovery. 8. Consider enrolling in antenatal classes for valuable information and support as you prepare for childbirth and parenthood. 9. Look into cord blood banking for your newborn. This choice could significantly impact your child's future health. Week 24 Pregnancy Tips. 1. Prioritize healthy eating. Plan a balanced, nutrient-rich diet to support your and your baby's health. Consider consulting a nutritionist for personalized advice. 2. Support your emotional well-being. Prioritize your mental health during pregnancy. Explore mindfulness practices and seek support from loved ones or professionals when needed. 3. Take prenatal vitamins. These supplements are essential for your baby's development and health during pregnancy. 4. Wear a seatbelt correctly. Position the lap belt under your belly and across your hips, not over your bump. 5. Is sex safe? During pregnancy, sex is generally safe if there are no complications. Always consult your healthcare provider for guidance. 6. Clean kitchen surfaces after cooking. Wipe down counters, cutting boards, and utensils after preparing food to reduce the risk of cross-contamination. 7. Wash raw fruits and vegetables thoroughly. Always rinse fruits and vegetables under running water to remove harmful bacteria or pesticides. For more videos like this, please like, share, and subscribe.